How would you grade yourself on your knowledge of the risks and side effects of your treatments? Even though non-invasive body contouring is much safer than the surgical alternatives, the treatments do carry risks and they have the potential to produce side effects. Some technologies more so than others. Now, to practice safely, you have to have a handle on the nuances of each technology. And as you know, there are some big differences. Today, we're going to take a look at cryolipolysis or fat freezing because, quite frankly, it carries the biggest risks and the most potential for side effects of any body contouring technology you'll be working with. Now, don't get us wrong. We love fat freezing. It delivers amazing results. We even offer a highly rated body contouring certification course on fat freezing. But we worry a lot about providers who may not know what they need to know when operating it. Now, even if you don't perform cryolipolysis or fat freezing treatments, and especially if you do, the information in this episode is critical to your body contouring career. So stay tuned.
You're listening to the Body Contouring Academy's Proven Profits podcast, where you'll learn simple, actionable strategies from real-world, successful body contouring professionals to help you generate more revenue, realize the profits you want, and create the life you desire. Hi, I'm Shannon.
And I'm Kay.
And we're your hosts of the Proven Profits podcast.
Hi there, healthcare professionals, business owners, body contouring technicians, and beauty professionals. Welcome, everyone. Kay here. Shannon and I want to thank you for being here too. Non-invasive fat reduction treatments, they're in demand and continue to grow in popularity, largely due to their reputation for safety. And while it's true that non-invasive fat reduction treatments carry very few risks and minimal side effects, some technologies carry more risks and cause more side effects than others. Now, to treat patients safely and effectively, you've got to know the downsides, the risks and side effects, as well as the upsides, the ease of care and great results of all the treatments. So in today's episode, we're focusing on the cryolipolysis technology. We're going to explore the upsides and the downsides of this fat freezing technology. We'll examine the cryolipolysis risks and side effects. And as we discuss it, we're going to compare the risks and side effects of cryolipolysis to other popular non-invasive fat reduction treatments like ultrasound fat cavitation and lipolaser. Now, in the first part of the episode, we're going to review fat freezing technology and the treatments, and then we'll examine the cryolipolysis risks and side effects in pretty good detail so that you have the knowledge base you need to practice safely. But before we dive in, it's important to note that we are not dissuading you from using fat freezing technology. We've spent nearly 20 years owning and operating med spas, and throughout those years, we've treated thousands of patients using many different non-invasive fat reduction technologies and devices. We believe cryolipolysis has a definite place in body contouring. It's the original fat reduction machine. It's the most well-known and recognizable technology in body contouring. It's among the 6 most popular, continue to be most popular body contouring treatments. And we believe in it so much, we've authored a top-rated body contouring certification course in it. Now, we did leave a link to that course if you haven't seen it and like to see that course details. But our point that we're making is that you must be prepared to manage and or prevent harm from the possible risks and side effects of every technology that you offer, including cryolipolysis or fat freezing. Now, we mentioned that cryolipolysis is the most recognizable technology, but one thing it also is the most misunderstood. And here's the common misunderstanding. I'm going to ask this question. Are cryolipolysis or fat freezing treatments and cool sculpting treatments, are they the same? Well, the short answer is no. And the long answer is no, not exactly, but it has a long, complicated explanation. So cryolipolysis fat freezing is the name of the technology that delivers cold temperatures to destroy fat cells. This technology can be utilized and is utilized by many different machines and devices. Cryolipolysis, fat freezing, well, it's a technology. It's not a particular device or machine, whereas cool sculpting is the brand name of the first and most well-known fat reduction device, and it delivers cryolipolysis fat freezing technology. Cool sculpting's the name of one device. It is not the name of the technology, and it should not be used as a label or to call any other device. But here's the problem. More often than not, the terms cool sculpting and cryolipolysis or even fat freezing, well, they're used interchangeably. And also, any and all machines that deliver the cryolipolysis fat freezing technology, they're often referred to as cool sculpting machines. But do you see now why this is wrong? And it's also so confusing, not only for consumers, but for providers. Now that we've cleared that up, let's move to the first part of today's episode, which is an overview of cryolipolysis fat freezing technology. How does it work? Well, it's a non-invasive body contouring technology that delivers cold temperatures to freeze fat cells until they die without damaging the skin or the surrounding tissue. Over a period of time, which is usually between 6 and 12 weeks after each cryolipolysis fat freezing treatment, the patient's body metabolizes and eliminates the dead fat cells and other debris left behind from the treatment. This is when you'll be able to see that fat reduction. So who are good candidates? Who are poor candidates for fat freezing? Well, the best candidate is a patient who has a small to medium-sized problem area that's just resistant to diet and exercise. Patients with large problem areas, patients who have a larger amount of fat, or larger patients can be treated and still see reduction, but it's just going to require more treatments to see the reduction they desire, possibly. Now, good candidates have good skin elasticity, and that means it'll bounce back when that fat's eliminated and that size of the body shrinks. Remember, the treatment's not intended to tighten loose skin. We recommend, as a matter of fact, against cryolipolysis treatments for patients who have loose skin or for older patients who have the normal skin aging issues. And there are a lot of contraindications, but important ones are patients who have poor circulation, a neuropathy, an implanted defibrillator, or who are pregnant or breastfeeding should definitely not have a fat freezing treatment. And then there's patients with rare cold sensitivity type diseases that should not, and that's paroxysmal cold hemoglobinuria, cold agglutinin disease, and cryoglobulinemia. None of these patients should undergo a cryolipolysis treatment due to the unique risk of increasing this risk of PAH. Now, we'll discuss more on PAH in just a minute. For now, you can learn both the upsides and the downsides of cryolipolysis in our course. And again, we've left a link in today's show notes if you want to take a look at the course details. But now it's time to move on to the second part of today's episode, the risks and side effects of cryolipolysis or fat freezing. And we're going to start with the treatment because those side effects and the risks, well, they start with the treatment experience. So let's review the steps. What is the patient going to be experiencing during the treatment? Well, the patient's treated lying down with the treatment area exposed. The provider is going to map out that treatment area, apply a protective gel pad, and then apply the fixed applicator to the treatment area. But some applicators have a fixed applicators have a vacuum that sucks in the skin and fat. Other fixed applicators apply only pressure, and there's some cryolipolysis machines that come equipped with non-fixed applicators that the technician moves about to treat manually. Now, as the fixed applicator or even the moving applicator lowers the patient's temperature to the -10 target, the patient's going to start feeling uncomfortable. She'll feel uncomfortable, deep cold, stinging, tingling, cramping, and maybe even a pinching sensation. These symptoms, they'll usually subside after the area goes numb, which is approximately 10 minutes into the treatment. Now, when the treatment's complete, the applicators are removed, and with fixed applicators, the patient's going to be left with tissue sticking up in the shape of butter, just like that applicator shape. This area will need to be massaged by the technician to smooth out, and it also helps kickstart the elimination of fat. Now, the treatment time, it varies between 30 minutes and an hour, and a couple of factors that determine the length of treatment time are the area being treated and the machine being used. There's probably about 100 different cryolipolysis machines on the market, guys. Okay, so now let's take a look at those difficulties during that treatment experience. You know, at best, cryolipolysis fat freezing is a challenging treatment experience for a patient or for most patients, and it is described as a painful treatment experience by some patients. Because remember, patients are going to be feeling that intense cold, the pinching, the aching, the stinging, and the cramping. And then that immediate post-treatment massage can also be extremely painful for many patients, at least during the first several minutes of the massage. Now, as you may know, other non-invasive fat reduction treatments like cavitation and lipolaser, they're performed without discomfort or pain. So managing a patient undergoing a cryolipolysis or fat freezing treatment is or can be more challenging. Therefore, as a provider, you must prepare to provide the necessary support for your cryolipolysis patients. And the risks and side effects continue post-treatment with a prolonged recovery period. Now, most patients don't need actual downtime following cryolipolysis, but there is still a recovery period that can vary in intensity depending on the patient. It's a recovery that's longer than all the other fat reduction treatments, like ultrasound cavitation, lipolaser, and it also has side effects that don't occur with these other non-invasive fat reduction treatments. So what are they going to experience, or what can they experience? Here they are. Soreness or pain, which can be short-term or long-term, redness or bruising and bruising, numbness, swelling, and the swelling that can last or typically last around 2 weeks, but it can last longer, up to a month. Remember also the first 5 days following treatments, as those nerves in the treatment area kind of like start coming awake and alive and regenerating again, patients can start to experience stinging, tingling, and cramping. About 1 to 2 weeks post-treatment, area will probably feel itchy, and if you have poor patient selection, the patient can be left with loose skin after treatment. Now, these fat freezing risks and side effects, they raise concern and they require special care. But there's one serious risk that we mentioned earlier, and it's totally unique to cryolipolysis, and that is PAH, which stands for paradoxical adipose hyperplasia. And what happens with PAH is instead of the treated area becoming smaller and shrinking and those fat cells going away, it causes a process that grows fatty fibrous tissue in the treatment area and actually becomes a bigger problem than it was before. Good thing is PAH is considered very rare, but many experts also believe that it's severely underreported. There are a lot of theories about the cause of PAH following a fat freezing treatment, but as of now, we really have not identified a cause. And the bad thing is PAH will not resolve on its own. Liposuction is usually the treatment of choice, and even in some cases, that does not work. Now, do you see PAH with other non-invasive fat reduction technologies? And the answer is no. PAH appears to be unique to the fat freezing technology. It's never been reported in any other non-invasive fat reduction technology. Now, did any of this cause you concern? It may have, but we can tell you cryolipolysis fat freezing is safe when it's performed by an experienced, knowledgeable body contouring technician. It's probably not the best first treatment to learn simply because it's the most challenging as far as supporting your patients both during and after treatments. But it's a great treatment to add to your existing menu. If you're just starting, a better way to start out is with a 6-in-1 machine where you can deliver multiple technologies that deliver great results and none of which carry the risks and side effects of fat freezing. We offer a 6-in-1 course too, in addition to our fat freezing course, and we'll leave a link to the 6-in-1 course in our show notes as well. Now, discovering the safest and most effective path in body contouring, well, it involves understanding the nuances of every technology. In today's episode, we dissected the cryolipolysis risks and side effects and compared it a bit to the other non-invasive fat reduction treatments. Now, while fat freezing delivers remarkable results, as a provider, you must possess a grasp of its potential downsides, including discomfort during treatment and post-treatment effects like soreness and swelling. Most notably, fat freezing carries that unique risk of PAH, which means you must express a careful consideration for both you and your patient. Thank you for learning with us today. We encourage you to obtain the knowledge that you need to practice safely. And for fat freezing, our Cryolipolysis Fat Freezing Body Contouring Certification course will give you the knowledge you need to make informed decisions and ensure optimal outcomes throughout your body contouring career. So check it out. Learn more about the Fat Freezing course now. Well, that's it for today, guys. Until next time, beautiful wishes.
If you enjoyed our podcast, we'd really appreciate it if you take a few minutes to leave us a review. And if you'd like to learn more about our courses and resources, you can get all the scoop by visiting our website, bodycontouringacademy.com. That's bodycontouringacademy.com. Thank you so much for listening. As always, have a great rest of your day. And until next time, beautiful wishes.